Hello, everyone. Today, I'm happy to introduce our incredible and exceptional Dr. Ramit.
Thank you so much.
And yeah, Dr. Ramit has a great experience in different countries, and he has a very nice education. Dr. Ramit, please introduce yourself. And let's. Today, we are going to talk about heart attack and some ideas, thoughts, and things which Dr. Ramit want to share with us from his point of view and from his, yeah. Dr. Ramit, please introduce yourself if I miss something.
Yes, heart attack is, first let me introduce myself. Okay, so
Yeah.
I'm a trained cardiologist. I have done my bachelor and then master degree in internal medicine, and then I did my PhD in cardiology, especially pediatric cardiology. So currently I'm in US, but I have lived around 20 years in China. I speak Chinese as well. And currently I'm in the US. So, well, I've been trying to get in touch with Alex. So now finally we are one-on-one with each other. I have read about your startup and it looks great. I mean, you guys have very good future and a prospect.
Thank you. Thank you so much. Thank you for your warm words and thank you for your introduction. Yeah. Actually, let's start from your background and let's start with a simple question. How you choose this medicine area? I'm sure maybe you have some family history or I don't know, other reasons or maybe something. Could you share why the medicine area and especially cardiology?
Yes, that's a great question. Nobody has asked me yet, Actually, my uncle, he was a doctor and I was always, he was an influencer. He always used to impress me a lot. So I thought I gave up, I made a decision to go for medical school. And luckily I got scholarship for that. So I went on studying. Why I choose cardiology? Because, in medicine, we have different specialization. And cardiology is something, which is really, one of the very bright careers, or you can say on top of medical practice. So, although it's a difficult work, if you compare to other like dermatology or radiology or others, stream of medicine. So I chose that because I wanted to be on the best. I wanted to do something, which is best. So that's how I come into the cardiology. It's nothing like anybody in my family had a heart attack or let's say any coronary artery disease or anything. So that's why I chose it. So yeah, that was the main reason for doing that.
Awesome. Yeah. And you mentioned about your scholarship, and actually you mentioned that you're from India, but how you choose China? I'm sure that you have several options, but you picked with the China University, and how it was, and what was the point in the time which you made a decision about university and place where you want to be graduated?
Yeah. So actually, I'm not from India. I'm from Nepal.
Oh, so sorry about that. Yeah.
So in Nepal, what happens is they have a different exchange program with many countries. So they send students over there on scholarships, that is fully paid scholarships. So yeah, I was lucky to have one of those scholarships, so that made me a decision to go to China for my studies. So that is where I get into a very good university. And after that, I kept on studying, continuing my studies. And this is how I, choose this career.
Yeah. I got it. And some words about China education, because, for sure, the medicine area has a lot of standards and sometimes the education seems the same, but I'm sure that you have some thoughts and maybe some things which related specifically for the China, specifically for the university which you graduated. Could you share this
Yeah, sure. I would love to. Actually, what happens, China is a big country. It's a huge country, which we all know that, with the largest population around. So what happened is, when I went to the universities there, they had a huge university, huge hospitals where you can get plenty of patients. You can get almost in any of the university hospital, you can get very rare disease, which you hardly find in US. So that gave me a lot of exposure to continue my studies. Yes, and also it helped me a lot. And those university hospitals, they have, as I said, they are huge, and they have very large number of patients. So in the meantime, you can also choose your different direction. For example, like say cardiology, I chose to go into pediatric cardiology, and especially into congenital heart disease, which is not very common practice in US. US, especially if you're trained as a cardiologist or pediatric cardiologist, or you don't have very, you know, uh, yeah, of course it's there, but it's not that common. So yeah, that is the background.
And you mentioned about the United States. Could you describe your experience? How you know about medicine area in the United States? Probably it was some of the work or research, or maybe graduation.
So can you come again the question? Sorry about that.
Yeah, I'm trying to ask you about comparison. For example, China, Nepal, United States. And my question is, are you familiar with the United States? And if yes, how this happened? It happens during research, during education, or?
Yeah, we have some collaboration with the UC San Diego, University of California, San Diego. So I was here first time. This is my third visit to US. So I was here first time as a exchange, because we have certain clinical trials going on, certain clinical studies going on, certain paper, we are trying to publish. So we have collaboration. So I visited first time at UC San Diego, and I was pretty well exposed to the American system, how they work, and how the hospital, how the things go on.
Wow, so, yeah, it's a very interesting practice. It's like exchanging the experience, knowledge through the planet, right?
Yes.
And you can share some ideas which you have in San Diego, and guys from San Diego want to go to the.
Yes, actually, Alex, I'll tell you something. There's a lot of things going on, exchanges going on. If you forget about politics, there's a lot of exchanges going on between, let's say, China and America, or China or India, or many big countries, which are upcoming countries. So there are a lot of exchanges going on. There are a lot of, you won't believe that almost 50 or 60% of the clinical trials, or for the new drugs, or let's say for the new modalities, which we have here, they get, they have clinical trials abroad, because it's easier, because there are a larger number of patients you can enroll for the trial, for the studies. So there's a lot of exchanges going on, a lot of collaboration, very friendly collaborations, and very fruitful collaborations going on. They have best of the both worlds, something like that.
Truthful professionals, they every time they out of all these politician intrigues and other things, and they do their work better and collaboration. And that's awesome. That's awesome. I never heard about this exchanging program. And I'm sure that our listeners understand your background and how you are familiar with all this problem. Let's talk about your general vision on heart attack problem. Why do so many people have problems with heart attack? On your personal opinion.
That's a relevant question. Yes, that's a relevant question. Actually, heart attack has been number one killer in Western world, or the first world.
Yeah.
It has been number one killer throughout maybe last 50 years. But actually, in the developing countries or upcoming countries or the third world country, it's becoming an epidemic. Why? Because there are many factors which influence that. For, let's say, clinical factors are like genetics. If you have somebody in your family, if it runs in your family, you can have more chances to, get that. Another one is sedentary lifestyle, nutrition, a lot of stress, working environment, not eating healthy lifestyle, and also, the alcohol abuse. So alcohol abuse, also smoking is also, one of the risk factor for heart attack. So there are multiple risk factor, genetic, if you have, let's say, a mom who is having a baby, who's pregnant, and if she's smoking or doing, which can mutate. So that can also, that is also an area of having heart attack. So heart attack is increasing. It is almost number one in now, even in the developing world or second world or third world, whatever we call it. Yeah, so because of but this was not there before, like let's say 50 years back, it was not an epidemic. It was number one, not number one killer, but now it is. Yes.
It's interesting. In other words, 50 years ago, there are no problem like this in Nepal, right?
Yeah, they had, but actually there are multiple reasons. Maybe that time we didn't have enough diagnostic tools. We don't have enough markers. We don't have enough, biochemical analysis, which we can analyze, or now we have better, predictable biomarkers, which you can predict, so what is going to happen with your heart after 10 years.
Yeah. And could you put some your thoughts on similarities and differences between the heart attack situation in Nepal, in China, and United States, from your vision, from your experience, and what you see?
Yes. Actually, what happens is that heart attack, the nature of the heart attack can be same in all the countries, but let's talk about the response, the medical response. In our country, what we have is let's say, I'm talking about Nepal, not China. What they have is, like in America or in China, even in China, they have proper screening. If you have a family history, then you're in a special danger zone. So you have been screened for that. You have been made aware that you are not having hypertension or hyperlipidemia, or other incidents which can cause heart attack. So there is a better screening. There's a better, you have timing to prepare. There are different multiple scores like Framingham score and other, lot of scores in practice, calcium score, which can predict, your heart attack or how is your heart is behaving. So in developed world, or let's say even in China, so that this is there that you can, prepare for it in advance. And let's say if you get an episode of that heart attack, so you can always, there's a management team who can immediately come and rescue you. But in developing countries or underdeveloped world, what happens is, it's very difficult to, many people, they don't get on time. For example, let's say if somebody has a heart attack, if we do a revascularization, that is PCI, percutaneous coronary intervention, if you do it within, let's say 5 to 6 hours, the person can be normal. There is no necrosis or the heart is, it will perform as normal as before. So those facilities are not there. People are not aware. Maybe they are not educated properly, or maybe they don't have that kind of logistic. Many places, they don't have logistic. For example, to get to a nearest, cath lab, you might take, 10 hours to travel over there. So so these are the differences, in both countries. But definitely, it's a very serious thing which needs to be addressed properly and done it in a right way.
Yeah, thank you so much that you find the time. I see that you are in the follow of the work, and thank you that you find the place.
That's okay, Alex. I would like to know more about your startup. If you can tell me more. Yeah, and if I can help you in any way, like China or India or anywhere, because I often visit there. I've lived in China for 20 years. I will be very happy to do that.
Yeah, thank you so much. In short, as a non-profit organization, we are aiming to decrease mortality worldwide. We started in the United States. Actually, our first product, this is a phone call system, which able to gather in blood pressure, gather in some healthy metrics like walk-ins, distance, some kind of these things, and system do it automatically without people interaction. This automatic voice recognition system.
Phone or some detachable device.
Phone, as a simple phone.
Okay.
Simple regular call, because we found that right now majority of the patients are 55 plus, and it's the reason why we are not invest a lot of time in mobile and web application, but in the future we will invest more time and more effort in this, because some of the cardiologists advised us that in the future there is a shift from the seniors, I mean risk heart attack from the seniors to the young generation.
As young as 30 years, I mean, if you talk about the largest, bigger cohort, as long as 30 years can even have a heart attack. Yes.
Yeah, and probably this will be opportunity for our non-profit organization to to have a conversation through the mobile application, through the web application with the young generation, younger generation, to reach out and to talk about more about the how to decrease heart attack risk. We are engineers. We're trying to involve marketing managers in our community and other guys, and we started conversation with the medicine professional community, cardiologists as you. Because engineers are good in engineering stuff, but
I appreciate engineers because they can create something. We just follow the doctors, just follow the protocols, but engineer, they create a lot of things, a lot of beautiful things which you can see. And that is great. Yes, please continue.
Yeah, and we want to gather in all these practices and advices to our system, or maybe some products. And after that, we're going to share this for free with with everyone in the world. We'll see how this will happen. And there are a lot of volunteering stuff on legislation and all other things related to the normal business stuff like marketing and other things. Before we drop off this call, can I ask some interesting question of you? Because you are,
please.
You have an interesting background. Yeah. And for sure, number one question right now: how does COVID influence heart failure and heart attack? And what do you think? What do you know about this? And what do you think about this? And what will be in the future in terms of COVID influence and everything related to the COVID and heart attack? Yeah.
Yes, that is a very good question. COVID, in our hospital in China, we are doing a study to see how the COVID, attacks the cardiomyocyte. Or let's say how it can, let's say there is a risk of embolism. After COVID, they can easily have an embolism episode. So in many COVID patients, we do thrombolytics. We treat them with antithrombolytics. So yes, if there is a thrombosis formation, you're going to have a heart attack, So that can clog your arteries and you're going to heart attack. Another thing is after COVID, when your lungs, when your lung alveoli, they start collapsing, and this in the blood, because lung is not lungs and heart, they are directly related to each other. So if the lung is affected, if it is really in a bad shape, let's say SpO2 is less than 70% or something. So in that case, oxygen saturation, in that case, it can directly have an overload or fluid overload on the heart or the circulatory system. So that can, sometimes that can cause, heart can compensate for that. It's not like that, but when you're not getting enough oxygen, that can, that can, because your heart needs more oxygen, it needs more blood, it needs more oxygen,
Yeah.
but your lungs are not able to deliver the enough oxygen. So that can cause a problem, and the heart cannot compensate. So this is, interrelated to each other. Yeah. And of course, there are multiple ways where COVID can affect your heart, not only heart, other organs as well. Yes, but yeah, I believe that it definitely, has effect on your heart.
Thank you. Thank you for this answer. And,
Yeah.
I'm curious about, for example, if you will have all resources, you will have team of the exceptional, great cardiologist in your under the you have all financial resources, you have all university of the world working on the project, and you will have everything. What top 3 things you will do to decrease mortality rate from heart attack?
The first thing is, of course, educating and evaluating patients. We must have a good system to evaluate, what is the risk of 5-year or 10-year heart attack? What are the risk factors? So there are different scores for that. You can use that score. The other things are, which maybe your company can also think as like biomarkers. They have very good predictors of biomarkers like NT-proBNP. We use often after surgery, cardiac surgery, and pro-BNP. So there are many good markers like uric acid, and there are a lot of markers which can predict your heart attack, or let's say coronary artery disease, or let's say cardiomyopathy, everything related to so do better screening. Number 2 is awareness. You can aware patients. So how can you do that? Yes, like you can do it, together with government agencies, or you can do it together with, like non-profit organization. So there are many ways you can collaborate for that to make awareness among the people. And of course, the monitoring is very important, so the monitoring, and I think there should be regular, especially for the high risk group, there should be regular monitoring, or, diagnosing or screening. We rather call it screening. So you should have regular screening for them. It should be mandatory. And yes, build up better facilities,
Yeah. Thank you.
More doctors.
Yeah, thank you so much for this answer. I'm sure that government and business will hear you and will follow your guidelines how to decrease heart attack. My next question will be, because we are engineers and we are very curious about technology and all stuff related to this. And from your doctor point of view, what do you think? How does technology help or don't help with the heart attack problems right now, in the future? These laptop, phones, I don't know, machine learning, all
sedentary lifestyle. Yes, sedentary lifestyle. Yes, technology has a very big role, very, very big role. I mean, huge role. For example, like I mentioned, you can predict heart attack. You can, prevent heart attack. You can prevent heart attack by making sure that all your metabolic problems, like let's say somebody has diabetes, some hypertension, some may have hypercholesterolemia, hyperlipidemia, hyperuricemia. So some more homocysteine. So what we can do is, technology has a very big role. Start from screening to evaluating, to diagnosing, to treating, preventing. Where there's a role of technology, different technology. Like for example, like you guys are doing that, you are monitoring that, so you can predict. So what I suggest, or what I believe, is that you can have more. Not only about lifestyle, you can have more parameters enter into it. Like, because diabetes mellitus diabetes is also one of the, very common sources. Very big risk factor for heart disease. Or, so not only heart disease, but many things. So, so we increase more parameters, more practical parameters. For example, nowadays they have a watch which can monitor their blood pressure, which can monitor their oxygen saturation, which can monitor their heartbeat, which can monitor their, what we call it, which can monitor their pulse and blood pressure also they can monitor. So, yeah, so putting all these parameters together, and trying to find out a solution which is practical. The most important thing is practical, because in daily practice, what we face is non-compliance of the patient.
Got it.
So non-compliance is very important, that if we can achieve almost 50% compliance, then that is good, very good.
Yeah. Okay. We are close to the end of our interview, and my last question will be, about medical systems and role of the insurance company. I'm sure that this role different. In China, it's one situation. In the United States, it's another situation. But what do you think? What's the role insurance company, government in this big problem, heart attack? Is it big, or is it necessary to change something in this? Yeah,
I think insurance companies. Sorry, you finished your question?
Did you finish your question?
Finished. I was so excited to answer this question. This is a very good question. Actually, insurance company has a very big role to play here. Either it's government insurance, firms, or private insurance firms, or they have a very big role to play. For example, if they can, do the screening or do the evaluation in advance, and they can, ask the customers to comply with that. So in that case, they are going to save huge medical costs, huge medical bills. They are going to save, right? So this way, this is symbiotic. This is, mutually beneficial for both of even the patients and even the insurance companies. So their patient have to pay if they get, let's say, screened properly, and if they follow the advice, and if they go for prevention, like take preventive medicines, prophylactic medicines. So that will help them, reduce the cost and also reduce the mortality.
Yeah.
So they have a very good role to play with each other, the patient and the insurance company and the government agencies. So this is something I think none of the insurance companies is doing. So this can be a great idea.
Yeah. In other words, if it will be some program or a screening procedure much more earlier than some case or heart attack happened, this really beneficial thing for the insurance company, because they will not pay for all this medication treatment and all of this stuff. And this is very good for the patient, because
they have to pay lower premiums because so this is mutually beneficial for. It's a very good area which people can work on.
Yeah. Okay, Dr. Ramit, thank you so much for all your insights which you shared with us today. I'm sure that we will, in the future, we will record one more interview with you, and you have an interesting experience and interesting education in different area, in different countries. And this is a very, and this is insights about exchange program. Very nice. Thank you for all your ideas. And
thank you, Alex, for having me.
Yeah. And if you have something to say for our listeners, or who will watch us, because we are sharing our video with the business, with the regular people, with the business community, with the medical community, feel free to send the message to the world, and we will be happy sharing this.
Yeah, sure, definitely. I mean, what I have to say is that heart is the most important. It's not the most important vital, but heart is the most important thing. And especially heart is also connected to your everyday life, so whatever you do, your heart beats up, right? So if you're excited, your heart beats up faster. If you're like sleeping, your heart can beat slower. So your heart is connected to your everyday life, and it is very important part of your life. So please take care of it. You know, to start with, you can start with the dietary thing, your nutritional thing, you know, so you can plan a good, take less salt, you know, take less fatty food or bulky food, which, you know, which has a lot of saturated fat. So take less fat, eat healthy, take care of your heart, especially if you have any family history or if you're going over 30 years old. So you have to make sure that you get proper screening, and you know, you know, there are a lot of preventive ways to which you can prevent heart disease. So also take care of other comorbidities, or let's say other predisposing factor, which can be risk factors. So also take care of. So basically, you have to stay healthy to keep your heart healthy, because it's connected to all your systems.
Yeah.
And yes, for the business purpose, I think there are a lot of much more things which we can do with the heart. So you know, there are much to be done. There are a lot going on. Actually, there are a lot of things going on. I mean, there are very amazing genetic or nanomedicine, genetic technology, especially after this 3D printing, artificial intelligence, AI. There are a lot of things going on. But apart from, you know, but there are a lot of business models available for these, you know, to handle this. There are a lot of business models available. I strongly believe that there's a lot of much more that can be done in this area. So yeah, stay healthy and listen to your heart.
Yeah, thank you. Thank you, Dr. Ramit. Thank you.
Yeah, welcome.
See you next time, and thank you so much for that you find time for us and for our community.
Thank you for having me, Alex.
Yeah.
Let's keep in touch. All right.
Yeah, keep in touch, and bye.
Bye. Have a nice one.